Peptic ulcer disease, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Peptic Ulcer Disease, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of peptic ulcer disease. Chapter 1. 1. What is peptic ulcer disease? Peptic ulcer disease is the development of sores or ulcers in the stomach or duodenum. 2. What causes the development of sores or ulcers in the stomach? The development of sores or ulcers in the stomach or duodenum happens when the acid produced in the digestive tract attacks the lining on the stomach or small intestine. 3. What is the duodenum? The duodenum is a part of the small intestine. 4. What are ulcers? Ulcers are open sores. 5. Can ulcers sometimes heal on their own? Yes, ulcers can sometimes heal on their own. 6. Can ulcers happen at any age? Yes, ulcers can happen at any age. 7. What are the two types of peptic ulcer disease? The two types of peptic ulcer diseases are gastric ulcer and duodenal ulcer diseases. 8. Can you have peptic ulcer disease without signs and symptoms? Yes, you can have peptic ulcer disease without signs and symptoms. 9. What are the signs and symptoms of peptic ulcer disease? The signs and symptoms of peptic ulcer disease include stomach pain, nausea, vomiting, heartburn, weight loss, bloating, dark stools, etc. 10. What is heartburn? Heartburn is a burning sensation in the chest, throat, and neck caused by acid reflux. Chapter 2. 1. What are the risk factors for peptic ulcer disease? The risk factors for peptic ulcer disease are kidney disease, liver disease, lung disease, NSAIDs, smoking, alcohol, gastronoma, anticoagulants, etc. 2. What is gastronoma? Gastronoma is a pancreatic endocrine tumor. 3. What are anticoagulants? Anticoagulants are medications that help prevent blood clots. 4. Can ulcers lead to complications? Yes, ulcers can lead to complications. 5. Name two major complications of peptic ulcer disease. Two major complications of peptic ulcer disease are bleeding and perforation. 6. Can perforation lead to sepsis? Yes, perforation can lead to sepsis. 7. What is sepsis? Sepsis is a life-threatening response of the body to an infection. 8. What are refractory ulcers? Refractory ulcers are ulcers that do not heal 3 months after treatment. 9. Can ulcers lead to anemia? Yes, ulcers can lead to anemia. 10. What is anemia? Anemia is an insufficiency of healthy red blood cells. Chapter 3. 1. What is melena? Melena is dark stool due to gastrointestinal bleeding. 2. What is dumping syndrome? Dumping syndrome occurs when the contents of the stomach move too quickly to the small intestine. 3. What is peritonitis? Peritonitis is the inflammation of the peritoneum. 4. Can ulcers lead to gastritis? Yes, ulcers can lead to gastritis. 5. What is gastritis? Gastritis is the inflammation of the lining of the stomach. 6. Can peptic ulcer disease lead to obstruction? Yes, peptic ulcer disease can lead to obstruction. 7. Can an obstruction in the digestive system lead to vomiting? Yes, an obstruction in the digestive system can lead to vomiting. 8. Is a bacterial infection a common cause of peptic ulcer disease? Yes, a bacterial infection is a common cause of peptic ulcer disease. 9. What is a common bacterium that causes peptic ulcer disease? A common bacterium that causes peptic ulcer disease is Helicobacter pylori. 10. Can peptic ulcer disease be treated? Yes, peptic ulcer disease can be treated. Chapter 4. 1. What are the treatments for peptic ulcer disease? The treatments for peptic ulcer disease are medications such as histamine receptor blockers, proton pump inhibitors, antibiotics, cauterization, endoscopy, antacids, etc. 2. What are histamines? Histamines are substances that causes an allergic reaction. 3. What are proton pump inhibitors? Proton pump inhibitors are medications that reduce the production of acids in the stomach. 4. What are antibiotics? Antibiotics are medications that fight against bacterial diseases. 5. What is cauterization? Cauterization is a medical procedure that involves burning a part of a tissue. 6. What is endoscopy? Endoscopy is a medical procedure that enables the visualization of an internal organ or tissue. 7. What are antacids? Antacids are medications that neutralize the acid in the stomach. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding peptic ulcer disease.